The end of World War II did not signal an immediate closure of the military hospitals that had proliferated across Europe, the Pacific, and parts of Africa and the Middle East. Rather, it ushered in a time of stillness and uncertainty as nations grappled with the aftermath of years of intense conflict. Hospitals that had once been critical in treating the vast numbers of wounded soldiers now faced an entirely new challenge: the transition from wartime necessity to peacetime redundancy. Within a few months of the armistices in 1945, the fate of these institutions was in question. Many were rapidly decommissioned, abandoned, or repurposed, while others became symbols of the pressing economic and logistical strains that plagued the post-war world. Across Europe, the sheer scale of military medical infrastructure was staggering. The United States, for example, had established over 1,000 hospitals for treating combat injuries during the conflict, with the United Kingdom operating nearly 400. At the war's peak, these hospitals were filled to capacity, and their resources were stretched thin. But as the war ended, the urgent need for these facilities vanished almost overnight. The millions of soldiers who had once been treated in these institutions were returning home. The world's military priorities shifted, and the hospitals were left with dwindling numbers of patients. Many of these facilities, once bustling with activity, now stood empty or underutilized. The financial and logistical pressures on governments were enormous. In the wake of the war, nations faced crippling debts and severe shortages of basic goods. The priority was not the care of veterans, but the rebuilding of entire economies. As a result, many military hospitals were simply too costly to maintain. The United Kingdom, for instance, was struggling to recover from the bombed cities and devastated infrastructure that had been the hallmark of the war. The United States, while more economically stable, faced its own pressures, with the cost of maintaining a wartime hospital system deemed unsustainable in the long term. Decisions to close hospitals were made not based on the needs of the wounded, but based on the cost of continuing to operate these facilities. In the United States, this led to a series of closures and downsizing of military hospitals starting in the late summer of 1945. Within months, thousands of beds were shut down. The War Department issued orders to repurpose or liquidate the infrastructure that had once served as the backbone of wartime care. The sprawling hospital complexes that had once housed tens of thousands of patients became increasingly redundant. By 1947, many of the temporary wartime hospitals were dismantled or transferred to civilian use. In some cases, they were abandoned entirely. The effort to scale back was driven by a stark reality: the U.S. could no longer afford to sustain such a massive wartime medical system. In Britain, a similar trend took place. The Royal Army Medical Corps began reducing its wartime medical establishments. Many of the temporary hospitals built to treat combat casualties were either converted to civilian healthcare facilities or closed. Some were repurposed for the treatment of civilians with the leftover resources that had once been dedicated to soldiers. In cases where the hospitals had been housed in large military barracks or converted buildings, they were handed back to their original owners or left in disrepair. Elsewhere, in nations like Germany and Japan, the situation was even more dire. Both countries had been severely bombed during the war, and the devastation extended to their medical infrastructure. In Germany, military hospitals became a casualty of the country's division. As the Allies established their occupation zones, many of these medical facilities were either completely abandoned or repurposed for the needs of occupying forces and local civilians. In Japan, the medical system had been overwhelmed by the demands of war, and after the cessation of hostilities, there was no immediate need for the vast hospital network that had been created to care for the wounded. Economic pressures in these countries were similarly overwhelming. In Germany, where the war had left much of the country in ruins, maintaining or rebuilding military hospitals was not a priority. The need for housing, food, and the rebuilding of industries was far more urgent. In Japan, with an economy in tatters and a society reeling from the aftermath of the atomic bombings, military hospitals were largely dismantled or repurposed for civilian use. The costs of maintaining these facilities were simply too high, and many were abandoned as a result. The medical staff who had spent years serving in these hospitals now found themselves in a new era of uncertainty. Many doctors, nurses, and medical personnel who had once worked tirelessly to treat the war wounded now faced their own dislocation. For many, their wartime roles had been so embedded in the conflict that transitioning to peacetime medical care was jarring. The decommissioning of military hospitals meant the loss of many military medical careers. In some cases, medical personnel were reassigned to civilian hospitals or to new government functions. For others, there was no immediate solution, and they were left in limbo, much like the hospitals themselves. One of the more notable aspects of this post-war medical transition was the eventual use of military hospitals for other purposes, particularly in countries like the United States and the United Kingdom. In some cases, these hospitals became sites for veterans' care, but with fewer resources and fewer medical personnel than during the war. In other instances, they were repurposed for general civilian health care, particularly in the wake of the war-induced shortages. In both cases, the shift from military to civilian care was not a seamless one. It was a necessary but often cumbersome process, as many facilities had been designed with the specific needs of soldiers in mind, not the general population. The repurposing of these facilities was fraught with logistical and financial challenges. As the war wound down, one of the earliest decisions made by governments was to address the sheer scale of wartime medical infrastructure. With many hospitals closing or being repurposed, a process of liquidation began. The process involved selling off equipment, materials, and sometimes even the buildings themselves. The military, now no longer involved in large-scale medical operations, looked to offload the vast amounts of medical supplies and equipment that had once been in high demand. The sheer volume of this equipment was staggering. The United States alone had more than 100,000 tons of medical supplies left over by the end of the war, much of which would be either repurposed or sold to other nations or civilian organizations. In some instances, military hospitals became neglected, falling into disrepair. Without the urgent need for their services, many were left to decay. Facilities that had been hastily constructed during the war, often using temporary materials and makeshift infrastructure, proved difficult to maintain once the immediate needs of the war were over. For a time, the silence within these hospitals was deafening. Rooms that had once been filled with the sounds of suffering and recovery now stood empty. The labor and resources that had been poured into these institutions seemed, in retrospect, both monumental and futile. By 1946, the transition from military to civilian medical care was underway. Yet, many countries still faced a stark reality. The economic conditions that had shaped the post-war world made it difficult to immediately shift these large, sprawling institutions to civilian needs. Despite the urgent demand for medical care, particularly in Europe, the economic situation of the immediate post-war years meant that resources were limited. The costs of maintaining these wartime hospitals, many of which were in poor condition, were simply too high to justify. The long-term fate of these hospitals, whether to be repurposed or decommissioned, remained uncertain as the world began the difficult process of rebuilding. By 1947, the scale of decommissioning and repurposing military hospitals continued to intensify, but the fate of these once critical institutions was far from uniform. While some hospitals were repurposed for civilian use, others faced outright demolition or abandonment. The logistical challenges of transitioning from military to civilian care were immense, and in some places, these hospitals stood as silent monuments to wartime necessity, now lost to the shifting tides of history. The economic recovery of Europe and Asia was slow and uneven. Despite the large-scale destruction during the war, the Allied powers had committed to rebuilding their economies through initiatives such as the Marshall Plan. However, this financial assistance did little to address the immediate challenges of medical care. In countries like Britain and France, where the need for post-war medical care was particularly pressing, there was a concerted effort to repurpose military hospitals. Yet, the scale of wartime infrastructure was too vast and too costly to maintain. In Britain, for example, the closure of military hospitals accelerated in the years following the war. Hospitals that had once been filled with the wounded soldiers of the British Empire were now underutilized, and the government faced mounting pressure to either convert them for civilian purposes or sell the buildings and equipment. The National Health Service, established in 1948, helped to absorb some of the surplus military hospitals into the broader healthcare system. However, not all were suitable for conversion. Some hospitals were built in makeshift structures, hastily erected during the war to address immediate needs. These facilities, often located in remote or war-damaged areas, proved difficult to repurpose. By the early 1950s, many of these buildings were demolished, their contents either sold off or scrapped. The financial burden of maintaining these once bustling medical facilities was simply too much in a time when the government was already stretched thin. Meanwhile, the United States faced its own set of challenges. The size of the U.S. military's medical network during the war was staggering. With over 1,000 hospitals spread across the country and overseas, there was an enormous amount of infrastructure to contend with. By 1947, the U.S. Department of Veterans Affairs had taken over much of the responsibility for caring for veterans, but the process of repurposing or closing military hospitals was slow. Some hospitals, particularly those that had been established in temporary structures, were abandoned outright, while others were converted into civilian medical centers or veterans' hospitals. The repurposing of these hospitals was often a haphazard process. Many facilities had been built in locations that were now no longer suitable for medical care. Remote, former military bases were left with crumbling infrastructure and outdated equipment. For example, many of the hospitals built in the Pacific were suddenly rendered obsolete as the needs of the military evaporated and the local population no longer required such extensive medical facilities. A few were handed over to local governments or other organizations, but more often than not, they were simply left to decay. One of the most notable examples of this repurposing was the transformation of military hospitals into veterans' care centers. The sheer number of wounded soldiers returning from the front lines meant that the need for medical care did not end with the cessation of hostilities. Veterans' hospitals became a critical part of the U.S. healthcare system in the immediate post-war years. The government, however, struggled to meet the overwhelming demand for services, particularly in the face of limited resources. Many of these hospitals were overcrowded, and despite the government's best efforts to increase funding, the veterans' hospitals were often underfunded and overburdened. Despite these challenges, some hospitals did manage to transition into the civilian healthcare system. As the 1950s approached, there was a growing recognition that military medical infrastructure could be used to ease the strain on civilian healthcare systems. In some cases, hospitals that had been originally constructed as military facilities were re-equipped and repurposed for civilian use. However, the process was far from seamless. The equipment that had been used in military hospitals was often outdated or unsuitable for civilian care. Furthermore, the personnel who had staffed these hospitals were often redeployed to other areas or faced a difficult transition to peacetime roles. The challenge of balancing the needs of veterans with the demands of the civilian population made the post-war transition period a particularly complex one for healthcare systems worldwide. While these repurposed facilities were essential in the short term, they were not a permanent solution. Over time, many of the military hospitals that had once served as wartime medical centers were replaced by more modern, civilian-run healthcare facilities. The cost of maintaining the large, sprawling military hospitals proved unsustainable in the long term. As healthcare technology advanced and new medical practices emerged, the infrastructure that had been hastily constructed during the war became increasingly obsolete. By the 1960s, the number of military hospitals had significantly decreased. In some cases, hospitals that were unable to be repurposed or absorbed into the civilian system were left to deteriorate. Buildings that had once housed thousands of patients were abandoned, left to decay in the post-war years. These sites were often sold off to developers, converted into housing, or left empty for years. In Germany, many military hospitals were repurposed for civilian use in the early post-war years, but by the 1960s, the majority had been abandoned or demolished. In Japan, the same pattern emerged. As the country's economic situation improved, the need for wartime medical infrastructure dissipated, and many military hospitals were either dismantled or repurposed for other uses. In some countries, especially those that had been part of the Axis powers, the fate of military hospitals became entwined with the broader process of denazification. Many of the hospitals that had served the German military were closed down or repurposed for use by the occupying Allied forces. In some cases, these facilities were simply abandoned, left in a state of disrepair for years. In Japan, the process was similar. As the U.S. occupation forces took control of the country, military hospitals were abandoned or converted to civilian use. The closing of military hospitals also marked the end of a specific era in military medicine. Wartime medical care had been characterized by improvisation and innovation, often driven by necessity. In the aftermath of the war, the focus shifted to peacetime healthcare systems, where the emphasis was on preventative care, chronic conditions, and non-trauma-based treatment. The rapid advances in medicine during the war had led to significant developments in surgical techniques, trauma care, and rehabilitation. However, as the military hospitals closed and the demand for such specialized care diminished, many of these innovations were transferred to civilian medical centers. The legacy of wartime medicine, however, was not forgotten. Many of the medical breakthroughs that had been made during the war, particularly in the treatment of burns, amputations, and post-surgical care, became the foundation for later developments in civilian medicine. The repurposing of military hospitals, while necessary, was not always efficient or smooth. In many instances, the facilities that had been hastily built during the war were simply not suited for long-term use. Some hospitals, built using temporary materials, had deteriorated to the point where they were beyond repair. Others were located in regions that were now less accessible or lacked the infrastructure to support them. Despite these challenges, many hospitals were preserved in some form, either as civilian medical centers, veterans' hospitals, or empty, deteriorating buildings.